Environ Life Science Limited, partnering for life.
Hello, everybody. I'm Dr. Nadeem. I'm a vascular surgeon. My main specialty deals with all the vascular diseases. So it's important to first of all identify and to acknowledge what is a vascular disease. Well, it's a very vast term, and what I would like to cover today, the leg pain. Most of the people in India between the ages of 18 and 65 or 70 are suffering from one or the other causes of leg pain, which is one way or the other associated with vascular diseases. Now, what is vascular disease? Well, anything that affects our blood vessels, the supply, or the drainage system, because there are two types of vasculature systems in our body. One is the arterial system, the other is the venous system. Arterial system deals with the supply chain, and the venous system is the drainage system of our body. Now, most of the people in India or globally for that reason are suffering from one or the other diseases because over the last 50-55 years, the lifestyle has changed. We have become more sedentary. Our food habits have totally taken a massive drift. And because of that, it's affecting our overall health. So let's come to the main topic which I would like to discuss today is the leg pain. Whenever we experience leg pain, it may not be of a very severe nature. It could be anything as mild as a cramp, which we are suffering from on a day-to-day basis, or maybe once or twice a week. And it could be anything as severe as which limits our walk, our mobility. And if that restlessness is prolonged, let's say it's over 10 days, 15 days that we have been experiencing this kind of a pain, it's very important that we should visit a vascular surgeon. What happens most commonly is that we usually contributed that Hanji, we are just hum thak gaye hain, we are tired, and that's why this is happening to us. But that is usually not the issue because 45 to 70% of the cases would be in one or the other way suffering from underlying vascular disease of any stage. It could be as mild as a stage 1 disease or last stage of the disease. Now, if we are experiencing leg pain, very common notion is that we might take some kind of a painkiller, or we might ask some domestic help if we have any at home, or if our children or our spouses or our relatives press our legs or do something for some 5-10 minutes, 10 odd minutes, and some kind of a massage. But it does give us temporary relief. So, by visiting a vascular surgeon, what happens is that he would advise you to go for any kind of a basic test like a color Doppler or some blood tests, which may show a couple of things, like it could be as mild as a varicose vein or as severe as a peripheral arterial disease. If we have a varicosities, so if we are, very early on in the disease, we could simply avoid, issues like surgeries, so that at the early stage we could just go with mid-thigh compression stockings and some mild medication and lifestyle change, which includes walking a lot, not standing in one position or even sitting. So this would help us. It would prevent, and if we are suffering from, God forbid, from any kind of a peripheral vascular disease which affects the arteries, even the veins, our cholesterol levels, or we could even monitor anything that is maybe something like our bad habits, like tobacco consumption in any form, or maybe alcohol consumption in any form, or even a high intake of fatty foods. So we could restrict all these things early on in the disease so that we would not be, affected by the severity of the disease. Today, globally, and especially in India, we are fighting for, going for an amputation-free India. Now, amputation is a big issue because amputation only because of one particular set of diseases is attributed to one or the other vascular disease. It would come as a surprise to you that diabetes since 2012 has been labeled not only as an endocrine problem, but also as a vascular disease because it does affect vasculature of your body, whether it is your kidneys, whether it's your heart, whether it's your peripheral. It's very common to see people with diabetic foot who have, suddenly they have some kind of a sore or an ulcer, which later on progresses to a very necrotic kind of a disease, very ulcerative kind of a disease. And then we have black toes, and subsequently we develop gangrene, and then we have to go for amputation. So all these things can be avoided. If we are suffering from diabetes, we have to take care of our feet, and we should, like we religiously visit our endocrinologist, we should at least once a year visit our vascular surgeon. Then is the issue of smoking, tobacco consumption. Tobacco consumption, we have labels all over the tobacco consumption of, oral cancers or lung cancers, and they're all displayed on the tobacco items, tobacco products. But what we miss usually is that tobacco is one of the leading causes of vascular accidents, which include both the central, that is the cerebral or the cardiovascular issues, as well as the peripheral vascular things like lower limbs or upper limb gangrenes. They're all attributed to tobacco consumption. So I would definitely advocate that the government should take in some kind of a important role in this and educate our population regarding the same, so that they would be made aware that your peripheral vascular disease, a big contributory factor is the tobacco consumption of any sort, whether it's chewing tobacco or smoking a BD or smoking a cigarette, irrespective of that. So, next time, whenever you are suffering from a leg pain, irrespective of your age, whether you're 18, whether you're 40, whether you're 60, 70, please, if it is extending more than 5, 10 days, or if it is regularly at a regular interval like 2 or 3 days in a week, do visit your vascular surgeon. Maybe we would be able to identify an early disease, and we could help prevent a lot of major medical or surgical interventions, and just a lifestyle change or very simple medication would help you out. So thank you. Let's make India amputation free. Let's make India free from all kinds of vascular diseases, and more health to you. Get well soon. Thank you, everybody.